안녕하세요.
안녕하세요. Have you seen someone bleeding from their nose and didn't know how to help them to stop this bleeding? Well, nosebleeds are called epistaxis. Epistaxis is a commonly found complaint. After watching this video, you'll be able to know all about epistaxis, its cause, how to diagnose and treat it. Hello everyone, I'm Queenie from CloudHospital TV. Today I'll be talking about nosebleed or epistaxis. Before we start, please subscribe to our channel so next time you'll be updated with our new releases. So let's start with what exactly is epistaxis. Epistaxis is defined as bleeding from the nasal cavity and esophagus and may be classified as anterior and posterior. Most nosebleeds are benign, self-limiting, and spontaneous, but some can be recurrent. Epistaxis more commonly occur in children from age 2 to 10 and older adults from 50 to 80. So what is anterior epistaxis? Anterior epistaxis refer to a nosebleed that originates from the frontal part of the nose. Most of the time, causes of anterior epistaxis originate from the Kieselbach plaques, which is a vascular network found on the nasal septum, as these arteries can be easily traumatized. Anterior epistaxis is most common type of nosebleed and usually involves one nostril. Now, let's talk about the risk factors. There are multiple risk factors for the development of epistaxis, and it can affect any age group, but it is the elderly population with the associated mobility who often require more intensive treatment and subsequent care. Local causes of epistaxis can include local trauma caused by nose picking, a foreign body in the nose, anatomic irregularities such as deflated septum, facial trauma, and rarely intranasal tumors. Systemic conditions. Systemic conditions that includes the risk of epistaxis include high pressure, vascular malformations, and bleeding disorders. So, diagnosis of epistaxis. It is critical in treatment to distinguish between an anterior and a posterior epistaxis. In most cases, direct visualization with a well-directed light source and nasal suction should be suffice for visual assessment. A topical spray containing anesthetic and epinephrine may be beneficial for vasoconstriction in order to stop bleeding and aid in the identification of the cause. Typically, posterior bleeding is diagnosed after all other attempts to reduce anterior bleeding have failed. Management of epistaxis depends on the severity of the bleeding and the individual's accompanying medical conditions. Treating minor nosebleed can often be managed at home with a simple first aid measures. Non-surgical approaches are usually enough to stop your nosebleed in more than 80 to 90% of cases. Treatment for anterior bleeding can be initiated with direct pressure for at least 10 minutes. You have to apply constant direct pressure by pinching the nose over the cartilaginous tip for a few minutes to try to control the bleed. If direct pressure doesn't work, anterior nasal picking with cloth glove finger picking can be used. Surgical therapy for epistaxis has largely been supplanted by the use of arterial embolization. Surgery is used for the bleeds that are refractory to medical and conservative therapy. Finally, how to prevent nasal bleeding. Overall, prognosis is favorable but varied. However, with adequate treatment, it is good. Most patients are unlikely to rebleed if sufficient supportive care is provided and underlying medical issues are managed. There are a few tips you can use to prevent nosebleeds, such as keep the inside of your nose moist. Dryness can cause nosebleeds. Don't smoke. Don't pick your nose. And don't use cold and allergy medication too often. Thank you for joining us in yet another video covering key health-related topics with CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible. 끝났습니다.